Hi, I am Dr. Dionne Bates, Senior Mental Health Advisor for BEAM, the Black Emotional and Mental Health Collective. September is PCOS Awareness Month. That's Polycystic Ovarian Syndrome. And I was diagnosed with this condition in about 2012 after many frustrating years of having symptoms and no one being able to tell me what was wrong with me. I went to three different gynecologists before anyone was able to tell me what was wrong with me. And by the time I got to the fourth gynecologist, she sat down with me about an hour and listened to me. And this was after her nurse spent about 45 minutes sitting down and listening to me. And it took some time, but she was able to determine that I was suffering with PCOS. A part of my issue is that I was having symptoms, but because my symptoms were not really textbook-like, it was difficult for a lot of clinicians to try to figure out what was going on with me. I think in part because I did not really present as a textbook patient who has PCOS. But what I learned throughout the process is that, number one, it's really important to be able to have a doctor who actually takes the time to listen to you. That is so important. It's also really important that if you are having issues with your body and you recognize that there's something going on with your body that is just not normal, or even if it's just something that is concerning to you, you have a right to seek treatment and ask questions. You have a right to advocate for yourself. Thankfully, I was able to get a really great gynecologist who was able to not only diagnose me properly, but also sit down and talk with me about some of the different ways in which the condition is treated. And in doing so, I was able to sit down and really think about what would be the best option for me. There are numerous different ways in which PCOS is treated. There's no quote-unquote cure for the condition, but there are many different ways in which the condition can be treated. And so if this is something that you are experiencing, understand that it can create a lot of anxiety, it can create a lot of fear. It may even create, for some people, sadness, frustration. For me, I had a lot of frustration, but finally got some relief at being able to speak with someone who was able to really tell me, this is what's going on with you. And then not only that, sat with me, took the time to listen to me, and took the time to let me know what all of my options were in terms of treatment. So for the month of September, if you are experiencing symptoms of PCOS, or if you are experiencing some of the symptoms that might be considered related to PCOS, please visit your physician. Ask your physician to send you to a specialist. Take the time to get your thoughts together, ask questions, be honest about what's going on with you so that they're able to assess your condition properly and diagnose you and give you a proper prognosis. I hope that this helps someone who may be experiencing PCOS. Take care.